Imagine a world where healthcare decisions are data-driven, and every remote primary healthcare center can use powerful tools to improve patient care. This isn't a distant dream, but a reality with today's technology. Choosing the right tools, ones that are accessible, affordable, and practical, is crucial for improving primary healthcare and addressing the challenges faced by providers and their institutions. DHIS2 is a robust, open-source global good platform used by over 80 countries to manage their health information. From data collection to analysis, DHIS2 offers a comprehensive suite of tools designed to streamline healthcare management. Due to extensive advancements in recent years, DHIS2 now excels in data analytics and dashboard creation. With DHIS2, you can integrate data from various sources for a complete view of healthcare delivery. Data from sources like electronic medical records, HR records, logistics, public datasets, community data, facility service delivery data from national HMIS servers, and data collected through other DHIS2 instances can be transformed and automatically pushed to your DHIS2 instance using BAO Systems Analytics Platform, or the AP. The AP seamlessly ingests data from various sources using built-in connectors. It transforms this data and pushes it directly to DHIS2 through the built-in destination pipeline. The data warehouse in the AP can directly connect to popular BI tools like Power BI and Tableau, or open source tools like Superset, using the available connection information. Once data are in DHIS2, its powerful analytics kick in. Healthcare workers can use DHIS2's advanced tools to spot trends, monitor performance, and make data-driven decisions. DHIS2 turns raw data into actionable insights with custom dashboards. These dashboards can highlight key metrics like disease outbreaks, vaccination coverage, healthcare worker-to-patient ratios, and patient outcomes. Integrated data boosts operational and strategic decision-making. Imagine the ability to customize a dashboard specifically for the indicators you are interested in. The ability to detect spike in disease cases early and mobilizing resources to prevent an outbreak. DHIS2 makes this possible. The interpretation features facilitate collaboration and can be configured to send out alerts via emails or the DHIS2 messaging app. DHIS2 ensures data quality with features like validation rules, duplicate detection, completeness monitoring, audit trails, and outlier detection. These tools help maintain accurate, consistent, and reliable data. DHIS2 uses a robust REST API. A REST API is like a bridge that allows different software applications to communicate and share information easily. This allows for DHIS2 to seamlessly integrate with BI tools like Superset, enabling advanced analytics and data visualization directly within DHIS2. It's available to all users, no licenses needed. Thanks to DHIS2 flexibility and extensibility, the Super BI app brings dashboards created using Superset directly to DHIS2 users. Another way that users can interact with analytics in DHIS2 is through the DHIS2 Android Capture app. This app can render analytics that have been created in the Data Visualizer app in DHIS2. Choosing the right tools for data analytics and visualization in primary healthcare settings is crucial. These tools must be accessible, affordable, and designed with the end users in mind. The right tools enhance adoption, which ultimately results in improved health outcomes for patients.